So I'm here to speak to you today about lumbar discectomy. This is a very common procedure. It is a procedure which is considered very safe and a procedure where the results are probably the best surgical results in spinal surgery. The patients who benefit from it most will be patients who have severe sciatica. So that's intractable pain that just really can't be managed by simple means such as painkillers or maybe an injection. And often it follows an injection where there is good evidence that a lot of patients will be able to avoid surgery by having a simple steroid injection, either performed by a radiologist or a surgeon. So if that then works, but then wears off in fairly short order, one might start considering surgery. If it works and it works very well for a long time, one might just repeat the injection. If the patient is struggling with pain, really can't manage things like sleeping, working, walking, they may start getting to the situation where they may want to consider the risks of a spinal operation. This spinal operation generally can be carried out either as a day case procedure or probably more commonly as overnight stay. It can usually be done through either a very small incision, and we use magnification to help us with the procedure, or there are techniques now where you can use maybe endoscopy or minimally invasive tubes type retractors. But the evidence for all of those is about the same, and the efficacy and the results are about the same. And those results look like about 90% of patients doing very well from that procedure, where the expectations are met, the pain in the leg is resolved. It's not usually necessarily an operation for back pain as such, but some people's back pain will get better. And the complication profile is very sort of reassuring to a patient in that the majority of patients are going to be able to go home within that 24-hour window. Complications such as CSF leak, where some fluid leaks from around the nerve, can be managed inside the surgery without needing to have procedures afterwards. Infection rates generally very low, probably some in the region of 1 in 200. And serious risks such as neurological injury, also very low, and certainly less than 1 in 200 from direct injury. But occasionally you might have some bleeding after surgery, which may result in needing to go back to the operating theatre to have that blood drained. But then if that is effective, then the long-term effects with that would be short-lived. I think the main issue for patients is probably recurrence of symptoms, so maybe a new disc prolapse happening or scarring happening around the nerves, and a group of patients who will have something called neuropathic pain, where there's essentially an electrical cycle that keeps running inside the nerve despite the fact that it's been freed up by the surgery. And that would contribute to that 10%, maybe 15% of patients who have moderate outcomes from their surgery, where maybe they feel that the surgery hasn't achieved what they set out to achieve. But for the other 85, 90%, this surgery is very effective. One needs to know, though, that the vast majority of people with disc prolapses don't need to go down that path, and probably about 90% will get better all by themselves in the first 3 months. So we're really looking at that mid to late group who are really struggling still, but the timelines are not in that acute phase.